Hey there, welcome. If it's your first time joining, I'm Debbie, and if you're returning, welcome back. I talk about gadolinium deposition disease. I talk about gadolinium-based contrast agents. I'm not a doctor. I'm not giving medical advice. I'm just sharing information. It's a growing community of people who've had adverse events. There's so much going on in the news this week, and I was reading and listening to some podcasts and videos and announcements, and I'm so excited to see all of the changes that are happening. I think as patients, we just have always relied on the medical community as the experts, and we haven't always done due diligence about being our own advocate. And that's how I ended up being poisoned by gadolinium. Truthfully, I was injected 4 times and no one ever even mentioned the word to me. Informed consent's a problem for contrast-based agents, and we need to change that. As a patient, I'm not advocating that we take it off the market. I am advocating that we have informed consent, that we are given a medication guide, that we're told about the risk factors. We do that for cancer patients. We send them home with information all the time and say, hey, read this. You need to know the pros, the cons, and the possibilities. We don't do that with gadolinium. And then further, when patients go to the doctor after being injected with gadolinium, having an adverse event or reaction, then they're told that's not possible. We never see that. No one ever has bad reactions to gadolinium. That's not the case. 2018, the manufacturer signed a letter that said it is retained in everyone. Some amount is retained in everyone, in the brain, the bones, the tissue, and the organs. And then in 2022, the CDC came out with this statement, right? Gadolinium toxicity. And I'm going to read some of these things I'm sharing today. So I want to, just so you know what I'm going to spend the next 10 or 15 minutes talking about. I'm going to talk about the CDC statement. I'm going to talk about the symptoms and side effects that are most commonly reported. I'm going to talk about the growing community and some of the informal polls that we do in the group to learn more and help ourselves as patients, because there is no antidote, there is no cure. Once it's injected, if you have an adverse event, then you're just left to treat any new problems, but nothing to eradicate or eliminate this toxic rare earth metal out of the body, which is retained in everyone, and it is accumulative. So it deserves attention. And we also deserve for doctors to stop the patient shaming, because that's what's happening with most of us. Anyway, let's get on with it. It's exciting news, and I'm so happy that the HHS and Secretary Kennedy and Dr. Marty and the whole team are addressing some of these things. I think we will all benefit in the long run. It's uncomfortable, it's unnerving for some of us, and exciting for others of us, because we've lived through some pretty bad times. So let's all just be kind to each other. Let's try and remember that we're learning, we're unlearning. And anyway, so the gadolinium toxicity statement, as posted in 2022 from the CDC, which is an agency who helps manage drugs along with the FDA. What they said is gadolinium toxicity has the potential to cause disease in humans, and even in small amounts may be associated with significant morbidity and mortality. That's a red flag, folks. And if you're being sent for an MRI and you're not being given that information, that's a problem. 91% of the people in a patient support group will tell you they were never afforded informed consent. Gadolinium toxicity can affect many bodily systems, including the musculoskeletal, the brain, the skin, the renal, and neurological systems. The toxicity can manifest itself in various symptoms and effects on the body, including but not limited to the central nervous system. Symptoms can include impairment of cognition, memory, impairment of sight, painful tinnitus, and angioedema. I probably butchered that word, but that has to do with swelling and inflammation. Additional manifestations can include impairment of your voice, swallowing mechanisms, cardiac arrhythmias, changes in blood pressure, impaired function of the GI system, the gastrointestinal tract, and the urinary system. Symptoms can be mild in some patients, while others develop severe life-threatening illnesses similar to cytokine storm responses. I did have a cytokine storm. 8 out of 12 cytokines that they tested were off the charts. My files were sent to multiple doctors, even a research hospital, a large research hospital here in the United States. They returned the file and said, "Your patient's sick, we don't want to talk to her." And I believe that was because we mentioned gadolinium, and gadolinium isn't discussed openly. Our patients will tell you that patients in our group will tell you that they go to the doctors. They're patient shunned, they're bullied, they're sent for psych evals, they're put on SSRIs and other medications that aren't helpful. And it's a problem. It's a problem that deserves attention. And so that's why we do what we do. I'm just one patient who speaks out about this problem that needs to be addressed. And that's why I follow the HHS, Secretary Kennedy, because I'm so excited to see the changes coming. Grateful for that. Very, very grateful. So I'm going to review 2 more documents, 3 in total. So the CDC statement we talked about. I think we talked about that we wrote a book. Patients wrote a book, Gadolinium Deposition and Toxicity, Humanizing a Life-Changing Event. I'm not here to sell books, but we certainly could use your support. 100% of proceeds goes directly to raising awareness about this problem. So it's on Amazon, paperback or Kindle. And it is English only for now, even though we have communities in other countries asking us to translate it. There's just no money. I want to talk next about common symptoms. And I'm doing this live today, and I'm talking through these things because it's so important. I don't know that doctors take the time, and I'm hoping if you're a patient and this resonates with you, that you can translate this back to your doctor and encourage them to read the research, to go out and find the CDC statement. They have access to it. We all have access to it now, thanks to changes that the HHS made about research documentation in the National Medical Library of Science is available to everyone. So if you want to research any topic about any disease, you should be able to find lots of research papers. There's over, I don't remember, there's like 14,000 papers written about gadolinium, I think. It's a huge number anyway. Please don't quote that number. Okay, so gadolinium toxicity, what are some of the most common reported symptoms? And I want to go through these because maybe it'll resonate with you or someone you know, and it would be worthy of asking more questions. So pain, burning, tingling, prickling, aching, deep bone pain, neuropathy pain. A lot of patients in our groups are tested right out of the chute when they first go to their doctor. They're tested for small fiber neuropathy, and a large percentage of those come back positive. Small fiber neuropathy can be for multiple reasons, not just heavy metals, but heavy metals seems to be linked to neuropathy issues. So that's one. Dermal changes, so tight, thickening, discoloration, pain, burning sensation, fascia tightening. So the skin itself gets really tight, hands get hard to bend, and fingers claw-like, all kinds of things. Muscle fascillations, which is muscle vibrations, twitching. That can be small, it can be local, it could be rapid contractions, and you'll see videos in the group. Patients record their twitching, the muscles on their legs or on their arms, twitching uncontrollably. It's disconcerting. Muscle weakness, muscle spasms. And I know when I was tested at the University of New Mexico and put into the patient repository for gadolinium deposition disease and testing for metals, that was one of the things that the physician who did he did my physical, and he said, "You have a lot of muscle weakness." And I said, yeah, and a lot of muscle wasting as well. My doctor treats me for muscle wasting. And I was a runner and I was active. I did CrossFit, so it wasn't like I wasn't taking care of myself. But anyway, that's just part of it, right? Neurocognitive symptoms, reduced cognition, brain fog, memory loss, personality changes, depression, anxiety. I will tell you that that's how I ended up with the second of 4 injections. The first injection gave me dementia-like symptoms. The doctors said, we got to figure this out. They put me back in the MRI machine, gave me a second injection, no one ever mentioning gadolinium to me or contrast agent. And I was trusting, blindly trusting. And what they learned was I didn't have Alzheimer's, but my brain was injured in 4 areas. So that was enlightening and life-changing. So that's one of the symptoms. Head pain, there's tightness and pain in the head, headaches, brain, burning, pain. A lot of patients tell us they just have this really tight feeling in their head. It's just brutal, tight pressure. They can't figure out what it is, and doctors can't figure it out for them. So we see a lot of patients in our group dealing with head pain. Deep bone pain, pain in the bones, the joints, and the ribs. That's really, really common. And I will tell you that with deep bone pain, a lot of times doctors will offer pain medications. And I would say that the majority of us in our group would tell you that pain medications don't touch the bone pain of gadolinium retention. So if you're a patient and you've had an MRI with contrast and you've been offered pain medication and it's not helping, I don't know, maybe it could be related to the gadolinium. I'm not a doctor. I'm not diagnosing anything. I'm just saying that we see that a lot. And pain medications really just do not work. A lot of patients go on SSRIs, all kinds of things, and that just seems to create more problems than to be helpful a lot of times. Rib cage, chest tightness, difficulty breathing, shortness of breath. Last year I was diagnosed with pulmonary fibrosis. Fibrosis is a problem for gadolinium, and fibrosis is showing up a lot in a lot of new diseases or more common diseases that people are seeing these days. So there's that. Changes to the eyes or vision. I will tell you that I have some eye problems. Lots of patients in our group talk about dry eye syndrome. They go to their eye doctor, they're using drops, and that can be heavy metal or not. We don't know. As I said, I'm just sharing symptoms here, but I did read a study where a couple years ago, the study came out and said that 88% of stroke victims, they were able to see gadolinium in the ocular part of the eye. So that's a problem. And I would say that dry eyes is a really big thing, but dry eyes can be from lots of things, right? So then we have cardiovascular changes and bradycardia. And I have bradycardia. I actually have an electronic problem and a mechanical problem with my heart. I was just diagnosed with HCM. We're trying to figure out how much of that's fibrosis versus thickening. Trying to figure out what to do, but every organ in my body has something wrong with it, and there's symptoms associated with every one of those organs. So for me to even think about having open heart surgery is a big deal, and I think it's a big deal for everybody. And if it is associated with this contrast dye, then we need to know, right? We know that we have patients in the group who have died from cardiac arrest, and when some of those patients' bodies were sent for autopsy reports, did come back showing that gadolinium was in the heart and in a lot of the body organs. Of course, autopsies don't prove causation, but we need to ask bigger questions and understand more, right? So we have lost people to that. And their, as I said, their autopsies did show the gadolinium in the various organs, including the heart. Hormonal changes, loss of MEMS, and that would be, there are problems with women in the group trying to get pregnant and losing babies. We have a gal in the group who is just a sweetheart. She is of childbirth age, and she's created a nonprofit to help women who are losing babies who have had gadolinium, and it's problematic for them to get pregnant. There's also a study that was done quite a few years back, and it talks about 1.4 million children were part of that study. I think it was infant to maybe just a few years old, but the study is one of the largest studies on children, I think, and 1.4 million. And and how they were impacted. So if you're interested in that, you can always Google it and search for it and learn more. So then chronic fatigue, that's a big one, right? And that's a big one for a lot of people for a lot of different reasons, not just gadolinium. Chronic fatigue, rapid aging with mitochondria dysfunction. And what we know is the mitochondria is responsible, it's the powerhouse for our energy. And so if you have chronic fatigue and you've had MRIs with contrast, maybe it's playing a role. We do know that the mitochondria studies talk about gadolinium is found in the mitochondria, and we do know that that is associated with energy levels, and that's important. It's hard to live a healthy, fun, well life if you're tired all the time and can't even get out of bed, which is the case for many of our patients. So there's that. Difficulty regulating body temperature, and that's an interesting one. Gadolinium does happen to be the coldest metal on Earth, and we are injecting it directly into the bloodstream, even though it's wrapped in a ligand that's supposed to make it safe. But body temperature is, and body regulation, temperature regulation is problematic for many of us. A lot of times we talk about in the groups, feel like you have a fever, but then when you take your temperature, it's like 94.7, and it's just like, that doesn't even make any sense. So there's that, lots of issues around that. ENT, so tinnitus, dizziness, swallowing, voice problems. I know choking is a problem for a lot of people, choking whether you're drinking or eating. And anyway, choking is a problem and swallowing is a problem. ENT, tinnitus, dizziness, we just talked about that. Edema, swelling of the extremities. We see that a lot with all kinds of skin issues and the swelling. I mean, inflammation is really just the body's way of saying something's wrong, right? And gadolinium is a foreigner. It's a foreigner that's retained. So it would make sense that the body would send all of its warriors out to eradicate it or manage it in some way. And it does, it is the same size as calcium. It's a calcium channel blocker. And so calcium and gadolinium compete, and it seems like the gadolinium is winning out and moving into where calcium usually is, which calcium, is in the bone marrow, and calcium is used in our teeth and so many places that calcium is a necessary nutrient, unlike gadolinium, which is a foreigner and a toxic rare earth metal and serves no reason to ever be in the body. So there's that. So we need to reconcile that. It needs to be reconciled. And that's why we do these. We want help. We want help from the medical community to reconcile some of these problems. So let's move on. Problems with balance. I can tell you that I've met a lot of people who use canes, walking canes, wheelchairs, and walking can be a problem. Staying upright can be a problem. There's dizziness, all kinds of things. And that's the thing when you go to the doctor, if they're not willing to talk about that you had an injection and it could be partly part of the reason for unexpected, unexplainable, unexpected, new and worsening issues, and you're not even looking at the complete picture, that's a problem. And specialized medicine has got us so focused on individual body parts, no one is looking holistically. Okay, keep going, Deb. So we're almost done with this list. Fatty liver. And fatty liver can be related to diet, right? But it can also be related to heavy metals. And I was just reading studies on it this week. I have an enlarged liver, and another 2 or 3 other patients were mentioning in the group that their liver's enlarged. They had pancreatitis. We were talking about how many of us had pancreatitis or pancreatitis-like symptoms or diagnoses, and then how does that relate to fatty liver or enlarged livers? And we know that food, and we live in a toxic world, so fatty liver can be from a lot of things, but it, we need more answers, right? And then the last thing on the list is what we talked about early on in this conversation, which is nephrogenic systemic fibrosis, and that was the first official diagnosed disease recognized and associated with gadolinium, and that was in 1997 that was reported. At the time, it was thought that the only way you got NSF, and it was NSF is the only way to get it was with gadolinium, but it was thought because it was for people who had compromised kidneys. We now know that the kidney function doesn't have anything to do with gadolinium toxicity and adverse events. We do know that fibrosis is a problem with gadolinium, seen in multiple organs, and we're still learning a lot about that. But nephrogenic systemic fibrosis now is a common term that's used. Instead of that, if you have functioning kidneys, is gadolinium iatrogenic fibrosis, and that can be in lots of different places or organs. And even in nephrology now, they see the gadolinium nanoparticles inside the kidneys, and they're questioning that. There's been so much research come out of the University of New Mexico. They have created a patient repository, and if you're a patient and you're having new and worsening symptoms, you're having problems since a gadolinium based contrast agent injection, I would encourage you to participate in the study so we can all learn together and figure this out. So thank you for that. Okay, I'm going to focus on one last slide, and that's the one where patients are doing informal polls. So these polls, we know they're informal. We're just patients. We're not doctors. We're not giving medical advice. We're just trying to figure out what's going on and how we can help ourselves get well. So these are some of the polls that we've done, and we just throw them out there and patients respond, and then we tally them up, and here you go. So I'm just going to list some of the common ones we've done. So again, we've already talked about 91% of the people say they were never given informed consent, a medication guide, or a consult to review the risks. That is a huge problem, and that's why it's number one on the list. 52% of patients say they received 1 to 3 new diagnoses. 1 to 3 new diagnoses that had nothing to do with their original ailment that they sought help for before they were injected with gadolinium. That's huge. 52%, 1 to 3 diagnoses. 53% of people, and this is where it gets really sad for the patient, 53% of the patients went back to the doctors 5 to 10 times questioning something was wrong. And if they did mention gadolinium, they were bullied, patient shamed, told they needed a psych eval, put on antidepressants, all kinds of things. But any time that you have patient groups coming back to you 5 to 10 times, it's time to pay attention and listen to what the patient is saying. No one goes to the doctor just because they love you so much. That's just not what we do. Okay, so 54% of people in this informal poll, this poll said they struggle with new and worsening GI issues, gastrointestinal issues. And we know that heavy metals, and this is documented, you can look it up, you can Google it, you can read it, whatever. Heavy metals do impact the body's ability to digest food and to go through the digestive tract, right? There's some things that happen with the biome of the gut lining, and heavy metals prevent absorption rate for nutrients. So that's a problem, and that could be why we're seeing an increase in GI issues. Those are questions that we have. We need more help figuring it out. And I really don't think we need more studies. We just need to reconcile the studies that we have out there, because I think we'll come up with these common things at a much larger level and volume to be able to tie it back, right? Or make some correlations. Okay, so 88% of patients in this one poll said that they struggle with chronic pain. And chronic pain, as we've talked about a little bit, is debilitating. It can be so debilitating that clothing bothers you, the sheets, the weight of the blankets. Patients don't go to bed because they can't sleep. The chronic pain, they pace the floors. I was one of those patients that did that. And the good news was there was a lot of patients up in the middle of the night, and we'd talk on the phone all night, and we'd try and figure out what we were going to do to get well. But chronic pain, nobody deserves chronic pain from a toxic rare earth metal that they were injected with. That's just not right. So what is it doing to the bone marrow? What is it doing to the mitochondria? And why don't we figure this out? Okay, 52% new and worsening unusual dental issues. Go figure, right? Yeah, sorry. That's horrible. And I used to be so vain, I would never have been on a camera 10 years ago. But it's the reality I live with. Dental problems have been a problem. I may have mentioned that in the MRI machine, I read a couple studies where they talk about dental, and if you already had like fillings and stuff, that the magnets are so powerful that it may be causing problems with the teeth cracking or moving the fillings. I don't know. I'm not saying that that's the case. I'm just saying let's be curious and figure it out, because 52% of patients in our group are struggling with new dental issues, and it's not cheap. I've spent over $14,000 on dental since gadolinium. That's ridiculous. My whole life I worked to spend just trying to get healthy. It's a terrible way to live. 59% talk about changes in sleep patterns. So is that the pineal gland? Is that the circadian rhythm? Combination of both? What is causing sleep pattern changes? And I will tell you that I slept less than 3 hours for the first few years. I even bought a special chair to take the weight off of the muscles and the hip bones and everything, trying to get comfortable and just do some cat naps. A lot of us talk about we sleep less than 3 hours, a couple 3 hours, and then we're wide awake again. And that's a problem, right? The sleep pattern. Is it the pineal gland? Is it the circadian rhythms? I don't know, but we need to figure it out. Sleep, if you're not getting regular sleep, and everyone needs 5 to 7 hours at a minimum, at least a few days a week. If you're not getting that, that's problematic for your health as well. Sleep is necessary. The only way your brain can detox is if you get sleep, and your brain needs to detox, right? We face thousands of toxicants every day, and so we need sleep so that our brain can detox. That's important. Okay, so then 54% of patients report being diagnosed with thyroid issues. Again, I can talk about that from a personal perspective. I had Hashimoto's for years. It was well regulated. The dosage stayed the same. And then after gadolinium, my thyroid went rogue. There are nodules on my thyroid now. They're worried it's cancer. I won't do the testing that they want because it's nuclear, and I'm not putting any more foreigners into my body. That's a personal decision. I'm not promoting that or not. I'm just saying 54% report being diagnosed with thyroid issues. That's huge. That's the endocrine system. That's what regulates your temperature and so many things in your body. So it's a big deal. Okay, so then we talk about the last one is that this is kind of a cool thing that we did. We went out and we grabbed the neurotoxicity symptom list from the Cleveland Clinic's definition, and we put it out there, and we asked patients to read through the neurotoxicity symptom list on the Cleveland Clinic website, and we posted it. 94% of people said that they related to their symptoms based on that list for neurotoxicity. That's huge. 94% of a group of patients. That's pretty big, right? And the interesting part of that is that the Cleveland Clinic definition of neurotoxicity, the top 3 things, and I think it may have been the number 1 thing on their list that they listed for neurotoxicity issues, was due to heavy metals. Heavy metals. There we go. Right? We have to figure it out, folks. It's problematic. We need help. It's a growing population. Industry doesn't want to talk about it. Doctors don't want to talk about it. That's wrong. People have never been sicker, and we need to figure out why. I'm thankful for the HHS. I'm thankful for Dr. Marty, for Secretary Kennedy, for President Trump, that we're finally going to unravel, and figure this puzzle piece out. I hope that gadolinium makes the list. It's not on the list currently. They have a lot of things on the list that they have to take care of first. But as a growing community, if you've had an injection, please, do some homework. There's a study and a patient repository out of the University of New Mexico. You do have to participate in person. They'll collect your hair, your blood, your nails, and your urine to look at that, and then they'll collect any other reports that you have about health problems or any biopsies you may have. They'll look at the tissue and see, or the biopsy samples. So get involved. We all have to get involved. It's a time of change. We all want to be moving towards wellness. We also want to repair our air, our water, and our soil. These products, all pharmaceuticals, end up in our water. That's problematic. It's hurting the plants and the fish and all kinds of things, which then come back to us. We eat the fish, we eat the planktons, we eat all kinds of things out of the oceans and out of the water systems. So it's just repetitive, and it's building. Toxicity's building. We have to change that. Let's do it. Let's be part of the solution. May your journey be one of wellness always. And until next time, take care. I'm not a doctor. I'm not giving medical advice. Gadolinium is wrapped in a ligand that's intended to be safe, but there's problems. That's the bottom line. I need to be very clear. I'm not suggesting we take it off the market. I am suggesting everyone get informed consent, and that we maybe don't inject it as frequently as we are right now. And I know that even industry is beginning to talk about that and suggest that it not be injected as frequently and for the little things that we used to inject it for. Anyway, take care. I gotta go.